Hi everyone, my name is Yi. Welcome to Occupational Medicine Pearls podcast. Today I would like to cover a variety of infections, and that is aimed at occupational infections that are encountered mostly in Australia. All right, let's start. The first agent I want to cover is leptospirosis infections or leptospirosis. It is caused by a spirochete bacteria called Leptospira interrogans, and it has spirochetes order, so there are about more than 250 known pathogenic serovirus. In Australia, there are a variety of them are available. In the cattle, we have, I think it is pronounced as Hajo. In the pigs, the Pomona, and Arborea is a type of serovirus that are emerging in Queensland since 2001 in the rodents, and it is an obligate aerobe, and it is thin, coiled, and highly mobile. The main feature that we need to know is it can survive weeks to months in the warm, moist, slightly alkaline fresh water and wet soil. It can't survive desiccation, UV light, or when the pH is less than 6.8. And unlike viruses, it can multiply outside the human body. That is important to know in terms of thinking about stopping the transmission. What type of occupations are at risk? Generally, we have to start thinking about environment, so it need to be warm, humid, and moist. So it is more likely in the northeastern part of Australia. If we are looking at dairy farmers, abattoir workers, banana farmers, stockmen, sugarcane workers, piggery, sewage or drainage workers, first responder, forestry workers, military personnel will be higher risk of exposing with this particular bacteria. Non-occupationally, if people do bushwalking or swimming in freshwater, camping in the endemic area, they may also get exposure as well. From the changes of our environment, like due to increasing rainfall, floods, and cyclones, that can impact where the bacteria could be found. How does it work? How does it transmit to us? It starts with reservoir. So rodents, rats, mice, and native rodents can be a major reservoir. They may be asymptomatic, and they can carry them in their kidneys for long term and shed in the urine. Cattle, pigs, and dogs or horses can be reservoir as well. Australian native wildlife such as kangaroo, wallabies, possum, bandicoots could be reservoir as well. From transmission, infected animal pee the urine and contaminate fresh water, wet soil, or vegetation. From that, the bacteria or spirochete could enter our body through aerated skin or water-softened skin, mucous membranes such as conjunctiva, mouth, or nose. If we drink contaminated water, or if we inhale aerosols of contaminated fluid, which is important in abattoir setting. There is very rare to see person-to-person transmission. Once spirochetes enter our body, it causes the leptospiremia or bacteremia phase the first week, and it is spread to kidneys, liver, brain, lungs, and heart. And in the second week, immune phase, and we start producing antibody against the spirochete, and we start shedding leptospira in the urine. During that phase, our body attack our own organs, causing vasculitis and other injuries, and that may present as severe disease, which cover hepatorenal syndrome or pulmonary hemorrhage. Clinical features: it can be incubation period, can be 1 to 2 weeks, and as previously stated, it can be biphasic. Phase 1 is acute phase from day 3 to about day 7. There can be sudden onset of high fever, rigors, severe muscle pain, headaches, and conjunctival suffusion, which is usually a main clinical sign that can be differentiated with other viral illnesses. It has to be non-purulent and bilateral. People may experience nausea, vomiting, diarrhea, abdominal pain, and cough as well. In the phase 2 immune phase, after a brief period improvement, people may experience recurrence of fever, aseptic meningitis, uveitis. About 10% of symptomatic cases may present with severe leptospirosis, called Weil's disease. It is failing of all our major organs, so think about kidney injury and liver failure, so jaundice. But the AST and ALT elevation with the leptospirosis is only 3 to 4 times compared to viral hepatitis, which can be a lot more than that. Pulmonary involvement can experience with pneumonia-like symptom, myocarditis, and skeletal muscle rhabdomyolysis could happen. When we're looking at the clinical parallel, the only thing we need to remember is that if people present with biphasic illness and if they present with jaundice, renal impairment, conjunctival suffusion, and severe myalgia with potential epidemiological or occupational history, we need to suspect leptospirosis. So, investigation, what do we do? For specific to the bacteria, we need to start with PCR and blood culture, and that's for the first week. PCR is to detect leptospira DNA. Blood culture is to take a sample that will take a few weeks to get results back. We don't wait the results to start treating. And after week 1, we can do serology. It may show the microscopic agglutination test, which is specific to Leptospira, and they can be 2 criteria. The first is single titer increase of 1 is to 400. More than that, that could be probable case. But if we have 2 measurement and if we can see 4 times elevation between acute and convalescent phase, and then that is confirmed. So that part is good to know, but it may take time and you don't necessarily need to be waiting that result before we start treating people. Urine PCR could be collected as well. With the other and any other investigation may include full blood count, liver function tests, renal function, coagulation profile, chest X-ray, or other standard investigations. How do we treat it? Antibiotics. If it is mild, doxycycline, 100 milligram BD, 7 days. Seems like too good to be true, but if it is moderate or severe, IV benzalpenicillin, and that would usually be the dose. Alternatively, we can give ceftriaxone 1 gram daily IV dose. They should be started when you suspect the infection. Do not wait for the lab confirmation, since lab confirmation may take weeks. Follow-up is important, so people can be excreting leptospira in the urine for more than a month after acute infection. That is important for blood and body fluid precaution, and that may not get to the humans, but other animals may get to it. Leptospirosis is an occupationally notifiable disease as well as publicly notifiable disease. So PCB, you need to notify the regulator for that. And if it is a compensable condition, if people acquire leptospirosis through work, how do we prevent that? This sounds quite a nasty infection. We go with the hierarchy of control. In the elimination phase, we need to eliminate the reservoirs. Or if we need to vaccinate the reservoir, well, we are not eliminating cattle, so we're gonna vaccinate them, but we could eliminate rodents so that, and it also need think about how do we design places so that rodents do not come. So that come into engineering control. So drainage improvement in the farming facilities or abattoirs are important, and separation of animal housing from work areas is important. Also, designing the slaughter or processing so that it minimizes aerosol and splash from the animals. From administrative control, which is how we design our work process to minimize the exposure to the bacteria, starting with educating workers what leptospirosis is about and importance of hand and personal hygiene to report if symptoms are present at early stage. Do not wait until when they are very sick. Safe work procedures and personal hygiene are important, so cover the wounds with waterproof dressing before work and avoiding immersion in the flood water or stagnant water where possible. They need to have higher suspicion level of that there can be something, that can cause serious infection. Hand washing after animal handling and before eating, drinking, or smoking. Shower after work and washing of the contaminated clothing with the proper washing is important. PPE, waterproof boots, gloves, and aprons are useful, but they are the last line of defense. Goggles, face shield, the same, long sleeve, and trousers. There is no standard health monitoring or health surveillance needed. When we are recruiting people as a pre-employment, this can be taken as an opportunity to educate or provide information to raise the awareness of the risk they are getting into. Chemoprophylaxis. Doxycycline 200 milligram weekly could be considered for short-term high-risk exposure, such as flood response or military operations, but not something we prescribe in standard working setting in Australia. That's a brief overview of leptospirosis. One of the framework that I only found out when I'm reading about this is called One Health Framework. So it is about collaborating between human health clinicians and animal health clinicians and environmental sectors for infections such as leptospirosis that could be present in the environment, animals, as well as humans. So that's a good find. All right, that's all for today about leptospirosis. I hope you find this useful, and I'll see you later.